effect of Shenyuan on inflammatory and rheological factors in porcine model of acute myocardial infarction.
Thank you very much for your kind introduction. And ladies and gentlemen, it's my great pleasure to share our work here. The topic is effect of Shenyuan on anti-inflammatory and hemodynamic factors in a porcine model of acute myocardial infarction. And our study is supported by the National Science and Technology Project for Major New Drugs Innovation and Development. And this report contains mainly two parts. The first part is anti-inflammation, and the second part is hemodynamics. So let me introduce this new drug to you. American ginseng is a traditional valuable herb which currently grows in Canada and eastern USA. And Corydalis yanhusuo, in Chinese, its name yanhusuo, grows wild in Siberia and northern China, and is now principally cultivated in Zhejiang and Jiangsu province of China. So we get the extract powder from these two drugs. Both of them have been used in clinical practice for many years on account of their salutary effect on cardiovascular system. So it's only a crude extract, and the major components contains genocide RB1, genocide RE, and genocide RG1, and tetrahydropalmitin. The first three components are mostly come from American ginseng, and this tetrahydropalmitin most comes from yanhusuo. So we have used totally 32 pigs, and they have been divided to 5 groups. Group S is sham operation group, and Group C is myocardial infarction MI control. Group L is MI with low-dose Shenyuan treatment. Group M is MI with moderate-dose Shenyuan treatment. And Group H is MI with high dose of Shenyuan treatment. And the myocardial infarction model was induced by the left descending coronary artery ligation. So and our drug, the oral administration started from 1 week before the ligation, continued to 2 weeks after the ligation. And the first part mainly focus on post-infarction inflammation. As we all know, after the myocardial infarction, inflammatories such as neutrophils, monocytes, and lymphocytes infiltrate into the necrotic tissues, as well as secrete inflammatory cytokines. The vulnerable myocardium is susceptible to wall stress, always resulting in infarct expansion. And in extreme infarct expansion may result in subacute cardiac rupture, and chronic infarct expansion may cause the formation of ventricular aneurysm, and finally progress to chronic heart failure. Combined with hypertrophy and dilation in the non-infarcted zones. So you can see the infarct expansion is really a bad outcome we don't want to see. So post-inflammation plays an important in it. So the resolution of the post-infection inflammation is so important, and it involves activation of multiple inhibitory signals, the recruitment and transdifferentiation of leukocytes with suppressive properties, recruitment of the Tregs, these Tregs, T regular cells, and the inhibitory monocytes always infiltrate into the subendocellular, and it is interacted by the chemokine receptor interaction. So Tregs is a lymphocyte subset with potent anti-inflammatory properties. Tregs exert suppressive function by cell-cell contact, or secretion of anti-inflammatory cytokines such as interleukin-10 and transforming growth factor beta, TGF-beta. So in this study, it comes to our study about the new drug. We aim to investigate whether Shenyuan has a beneficial effect on the Treg-associated anti-inflammatory response. So the Treg-specific protein FOXP3 expression in heart was studied by Western blot, and Treg accumulation and distribution in heart was studied by immunohistochemistry, and Treg-associated cytokine, interleukin-10 and TGF-beta levels were tested by ELISA kit. So this is the result. You can see that the MI pigs, the infected pigs, showed a lower expression of FOXP3 in both the infected zone and the non-infected zone, here and here. And in the infected zone, you can see all dose of Shenyuan elevated the expression of FOXP3, and the increase is more noticeable in group H than group L. In the non-infected zone, only the high dose of Shenyuan increase the expression of FOXP3, not the low dose and the moderate dose. And the distribution of Tregs, Tregs is stained by dark brown color. Dark brown, you can see this. We can find that Tregs always single within myocardiums in the sham-operated pigs, and sometimes clustered in the necrotic tissues in the MI pigs. And after treatment of Shenyuan, more Tregs clustered in the infect border or across the gap. Across the gap within the myocytes, where we think the vessels is their source vessel. And this is the plasma interleukin-10 and the TGF-beta level from pre-MI to post-MI 14 days. You can see there's no significant difference in group S. But MI resulted a marked reduction of interleukin-10 at post-MI 2 days. And high dose, the line, the blue line, the high dose of Shenyuan elevated the plasma interleukin-10 significantly at post-MI 7 days. And consistent with the trend of interleukin-10, you can also see a progressive increase of TGF-beta in group H, the blue line. What's more, it seems that high dose of Shenyuan is more potent in upregulating anti-inflammatory cytokines than lower dose. At post-MI 14 days, group H has a much higher level than the orange than the group L, and at post-MI 14 days, group H has a much higher level of TGF-beta than group M and group S. And then the second part is about post-infection hemodynamics. As we all know, after the MI onset, there comes impaired systolic function or diastolic function, and the increase of blood viscosity and platelet aggregation comes out. So how to improve the blood rheology and effective control the blood viscosity and platelet aggregation is important. It helped us to accelerate the thrombolysis or reduce the risk of new embolithrombolism. So we measured the blood viscosity, both the whole blood and the plasma. Whole blood viscosity contains different shear rate at 15 per second, 30 per second, and 150 per second. And we also measured ADP-induced platelet aggregation, also the hemodynamic measurement, including peak left ventricular pressure rise, the plus dPdt, and decay, the minus dPdt, and also the left ventricular end systolic pressure, LVESP, and the left ventricular end diastolic pressure, LVEDP, and the mean pressure, LVMP. Also the aortic systolic pressure and the diastolic pressure and the mean pressure. And this is the result of the blood viscosity. We can see that there is no significant difference at pre-MI, but at post-MI 14 days, you can find that most of the value of WBV at 15 per second increase, although it is without significant difference, but all dose of Shenyuan treatment attenuate the values, and the lower values of WBV of 30 per second and 150 per second were also observed in group M and group H as compared with group S. And the PV value, plasma viscosity value, increased significantly as compared with group S, but it can be reduced by low and moderate dose of Shenyuan. The plasma became less sticky, and this is the result of the ADP-induced platelet aggregation. After the 2 days after the MI, we can see the platelet aggregation rate increased in group C, but low and high dose of the orange and the blue, the low and high dose of Shenyuan attenuate the increase of platelet aggregation rate. And the hemodynamic changes, there is also no significant difference pre-MI, except maybe there are something in AOMP. But post MI 14 days, you can see that this round is group C, and they have a lower value than group S, and low and all doses of Shenyuan. I think all doses of Shenyuan can reduce the value of plus DPDT and LVESP, LVMP, and AOSP.
Yeah, 5 minutes.
Okay. And in particularly, Group M have a much higher value of LVMP than Group C. So, as a recognition of the above, we conclude that Shenyuan elicited a significant anti-inflammation response, which was characterized by increasing FOXP3 expression and Tregs accumulation in myocardium, and upregulating circulating anti-inflammatory cytokines, interleukin 10 and TGF-beta. Shenyuan also facilitated post-infectional hemodynamic stabilization by improving rheological parameters, including the whole blood viscosity, plasma viscosity, and platelet aggregation rate, and plus DPDT, LVMP. High dose of Shenyuan was more potent in a porcine model, but clinical efficiency remains to be investigated. So that's all. Thank you for your attention.
Question? So I have a question. You said that Shenyuan has only 2 halves, made from only 2 halves.
Yeah.
So which half mainly have such effect?
I think maybe it has one half is American Ginseng and another half is Corydalis yanhusuo. I think according to previous study, American Ginseng has an inhibitory effect on inflammation mostly, and yanhusuo mostly have the inhibitory effect on the reducing the blood rheology, improve the blood rheology. In Chinese, 运气, 盐湖所运气. Yeah, so it maybe have a more effect on the blood rheology. So we can combine these 2 kinds of drug.
Congratulations.